Good morning. I'm so happy to see such a big group here today. The conversations so far have been really interesting, and I'm looking forward to having lively debates throughout the rest of the day as well. But for now, it's my pleasure to introduce Jesse Ehrenfeld, who's a doctor at Vanderbilt down in Nashville, as well as a trustee for the American Medical Association and a combat veteran who was deployed to Afghanistan. And he's going to speak with us about his work on behalf of LGBT patients here in the US. So please welcome Jesse.
Thank you very much. Appreciate it. It's a pleasure to be here. I've been asked to talk to you about an issue that is really fundamental to success in business, an issue that drives 10% of the global economy and yet threatens individuals in every organization across the globe, and that issue is health and the health of LGBT individuals. As both a practicing physician and a member of the Board of Trustees of the American Medical Association, I've seen firsthand how promoting diversity and inclusion can actually improve the health of LGBT individuals, and in doing so, improve the bottom line of both business and government. Now, while I currently practice, as Charlotte said, in Nashville, Tennessee, I've had a career as a physician in both the civilian sector as well as the United States Navy. When I joined the Navy, discrimination in the military was common. Gay and lesbian officers and enlisted sailors and other service members who violated the Don't Ask, Don't Tell policy were discharged routinely until 2011, when Congress finally ended that ban. And transgender individuals were also discharged after being diagnosed with either gender identity disorder or gender dysphoria, a medical condition associated with severe distress that can happen when there's a mismatch between one's biological sex and gender identity. Individuals were sent home, people like Major Jamie Henry. Dr. Henry is a military physician, and she also happens to be transgender. And she's somebody who served as best she could, living in isolation, in shame, and in fear, being misdiagnosed with an anxiety disorder. Then she was called bipolar. And it wasn't until recently, in 2016, that transgender individuals in the military were able to actually get resources and support. Previously, they were able to seek support in silence, go outside of the military system to get resources, medical and psychological assistance. And although the situation has improved today, there still is a long, long way to go. Now, I came to know Jamie, and I helped her submit a statement to the American Medical Association to take a stand in support of transgender troops. And in 2015, the AMA passed a resolution stating that there is no medically valid reason that a transgender person cannot serve in the military. And the AMA's leadership on that policy helped pave the way for the Pentagon's ultimate decision just last year. In fact, this photo is of me in the Secretary of the Army's office just a few hours after that announcement was made to reverse that ban. Now think for a moment, if Major Henry, Dr. Henry, had been forced to leave the military. We would have lost a top-notch Army physician that the military had paid dearly to train, and multiply Dr. Henry's story by the thousands of others who are out there who have not had a similar ending. And you'll start to conceptualize the tremendous cost that as a society we pay when we allow discriminatory practices to persist in our organizations. Ignorance and fear have absolutely no place in the military, in healthcare, or in business. Business leaders understand that keeping people healthy is good for the bottom line. Healthy employees are better able to do their jobs and are less expensive to care for. And that's why good business leaders ensure that their employees have access to good, quality insurance coverage, an adequate, solid network of providers that can provide support and help for LGBT individuals, and maybe even a workplace wellness program. But as you can see through Dr. Henry's story, an employer's willingness to understand, celebrate, and support LGBT individuals also plays a role in their health, and eventually will show up in a company's bottom line. Now, as a physician, I need to know who my patients are. They have to be able to trust me with information about their sexual orientation and gender identity. Without openness and trust on both sides of the physician-patient relationship, a person's health will suffer. Not knowing somebody's sexual orientation or gender identity makes me a less effective clinician because I can't make the right treatment decisions. Think, for example, about an African-American man who comes to see me for preventive care. Now, I understand that he might be more susceptible to diabetes and sickle cell anemia because he's African-American, and we'll screen him for those conditions. But if he does not feel comfortable telling me that he is gay, I might not think to screen him for HIV or depression. And if he is HIV positive or has depression, and that goes untreated, his health will get worse, and those costs will be more. Unfortunately, today, in America and across the world, LGBT people experience substantial health disparities compared to non-LGBT individuals. We have higher rates of tobacco, alcohol, and drug use. We are more susceptible to depression and more likely to contract HIV and other sexually transmitted diseases. So how can we improve the health of LGBT people? Well, to start, LGBTQ health is a relatively new field, and we need to do a much, much better job of training clinicians to understand how to care for these patients. I recently co-edited a new textbook of LGBT health so that students and trainees can better understand the specific needs of LGBT individuals. As I mentioned earlier, the AMA has played a lead role in educating the military and the public about the fact that sexual orientation and gender identity is not a psychological or medical disorder. We have very strong anti-discrimination policies, and we encourage all of our physician members to post those in their offices so that patients will feel comfortable coming out. A decade ago, we called on insurance companies to stop denying coverage based on sexual orientation or gender identity. And just 3 years later, Congress effectively banned that practice through provisions in the Affordable Care Act. Now, the AMA has also called for better education amongst physicians and the public about pre-exposure prophylaxis, or PrEP as it's more commonly known. This is a prescription medication sold under the brand name Truvada that's taken once a day by those at high risk of contracting HIV. Now, despite a 99% effectiveness rate at preventing HIV infections, only a small percentage of those who are eligible for it are taking it today. A simple HIV infection results in a lifetime of healthcare costs that range well into the six figures, not to mention the misery and anxiety that it can cause for an infected person. Collectively, we must do better. Through the AMA policies I have mentioned and dozens of others, we are taking a strong stand against discrimination and for good health for LGBT people. When I think about the theme of the meeting today, my bottom line for all of us, those in healthcare, government, business, the medical profession, is that we need to work together to create an environment where LGBT people feel comfortable and valued, where our needs are well understood, because at the end of the day, good health is good business. Thank you.
Thank you for that. That was a very interesting overview of how the LGBT community health issues have been evolving both in government and in the private sector. Today is a busy day down in Washington for Congress as they consider the Affordable Care Act.
It's a little bit going on.
Yeah, so how would you characterize the effect of a repeal on the LGBT community? Obviously, there are so many ramifications for people of different incomes, but how would you characterize the effect of that if it were to pass?
Catastrophic is probably the best word that I could use. The Congressional Budget Office estimated that the current proposal being looked at today would take away health coverage from 24 million Americans by 2026, 14 million Americans in the next year, and LGBT people would be disproportionately impacted by that loss of coverage. Unfortunately, we know that LGBT people are more likely to be uninsured and underinsured compared to their counterparts. And colleagues of mine at Vanderbilt have published a lot on that recently in some of the peer-reviewed literature this past year. So unfortunately, the current proposal as it stands would be, I think, damaging to progress that we've made in terms of getting people coverage. And so that's one of the reasons why the AMA came out strongly against it.
What can businesses do? Of course, the Affordable Care Act, as you just said, if it were repealed, would take coverage away from over 10 million people just in the next year. But businesses in America still provide insurance for a far greater number of people than Obamacare's exchanges do. And so thinking about employer-sponsored coverage, what are steps that employers in designing their health packages, whether they're self-insured or working with a big insurance company, how can they design policies that support LGBT health?
I think it goes by asking the question, and we've seen a number of organizations that have taken a serious look at how is the benefits design impacting what people can actually access, and that spreads from not just what kinds of services are covered, the current status of the federal requirements for inclusion of transgender coverage are a little bit up in the air because of changes in the administration, but that doesn't actually impact decisions that private employers can make. And so private employers should make sure that their policies are supporting people appropriately. The other issue that often comes up are around employee wellness programs. I am familiar with an organization that has a very successful employee wellness program, and when they took a look at some of the modules and things that people have access to and go through online, they were not gender inclusive. And so if you are a trans man and you went through kind of the thing where it tells you, you should eat more vegetables and get more sleep and do all those kinds of things that are helpful, it actually gave you the wrong medical advice because it wasn't inclusive of those individuals. And I think employers can be very successful in supporting LGBT people if they take the time to actually engage and look. At the end of the day, the costs are low, but the rewards are high because, again, when you keep people healthy, they'll be better, more effective employees.
We have time for probably one question from the audience, if anyone has a question for Jesse. Okay, then I'll end with my own. And if you think of one, I'm sure you can tackle him at lunchtime. But there have been a number of religious freedom laws that have been passed or at least considered. Sure. Is there a legal possibility for a doctor to refuse treatment to an LGBT person? Is that something that is allowed in the United States? Sure. Or could be if these laws became more widely spread?
Legally, yes. Ethically, no. The AMA has very, very strong ethical policy that we have a professional obligation to take care of everybody and to not discriminate. And unfortunately, those laws are likely to continue to be brought forward. But from a professional standpoint, the answer is very clear. It's not okay to discriminate.
Does a doctor face any repercussion from the AMA? Is there any sort of penalty for violating that ethics law?
There are processes that the AMA does have to revoke membership or take other sanctions against those individuals that behave badly, but it's sort of an extreme thing that we don't see too often in this context.
Okay, well, we'll have to leave it there, but thank you so much.
Thank you.
Please thank Jesse. Thank you.